I want to start with something you need to hear. High blood sugar doesn't always come with obvious symptoms, but your body is warning you every single day. The scary part? Most people ignore these signs until serious damage is already done. Feeling thirsty all the time, going to the bathroom more than usual, even constant fatigue could be a silent warning. And here's the truth. One of these signs is often overlooked, and it could put your health at serious risk. In this video, we'll reveal 7 warning signs your blood sugar is dangerously high, and if you notice even a few of them, it might be time to take action. Make sure you watch until the end, because the last signs could protect your health. Before the countdown, basics in plain language. Glucose is the sugar your body gets from food, fuel for every cell. Insulin is a hormone made by your pancreas. It acts like a key, unlocking cells so glucose can enter. If insulin is low, or cells ignore it, glucose builds up in the bloodstream. High blood sugar strains tiny blood vessels, it stresses the kidneys, it stresses the eyes, it weakens immune responses. That's why small symptoms can signal larger problems if unchecked. I'll walk you through 7 silent warnings, ending with 2 often overlooked. If several apply to you, your body is asking for help. Number 7. Frequent urination. I see patients shrug this off all the time. They think it's just a bladder issue or they're drinking too much coffee. But when blood sugar is high, your kidneys filter excess glucose into urine. Glucose drags water with it, increasing urine volume and frequency. You might be getting up several times at night, or running to the bathroom more during the day. This isn't just annoying, it's a sign your body is struggling to keep blood sugar in a safe range. Over time, the extra workload can damage kidney tissue and lead to longer-term kidney problems. Notice frequent urination often pairs with thirst and with fatigue. When these signs cluster, they point to the same underlying issue. Pay attention to timing and volume. Are you waking up multiple times at night? Is it more than usual for you? Also consider recent changes. New medications, weight changes, increased stress. Track frequency, and discuss it with your clinician. It can show whether blood sugar testing is needed sooner. Simple immediate steps. Reduce sugary drinks, cut back on diuretics like caffeine late in the day, stay hydrated with water. If persistent, get a blood glucose check to rule out metabolic issues. Number 6. Excessive thirst. Thirst is your body's alarm system for lost fluids. When blood sugar pulls water into urine, you will feel thirsty. It's that dry mouth, the constant need for a drink. One glass never quite satisfies. People often reach for sugary sodas or juices, thinking they need a quick refill. That actually worsens the problem by raising glucose even more. Thirst seems harmless. Everyone gets thirsty after a workout or on a hot day. The difference is persistence and context. If you're drinking more than usual across days or weeks without an obvious reason, and especially if you're also urinating more, it could be high blood sugar. Persistent thirst paired with fatigue should raise a red flag. Thirst is also tied to electrolyte imbalances. When you lose fluids, minerals like sodium and potassium shift too. That can cause headaches, dizziness, and even heart palpitations in extreme cases. Paying attention to how thirsty you are plus what you're drinking can help you spot a pattern early. Immediate actions are simple. Choose water first, avoid sugary beverages, and monitor how often you're refilling your glass. If cutting sugary drinks doesn't reduce thirst quickly, consider testing your blood sugar or seeing a healthcare provider for further evaluation. Number 5. Constant fatigue. Number 5. Constant fatigue. This is one of the most frustrating symptoms because it affects everything you do. You eat, but your body's cells aren't getting the fuel they need because glucose is stuck in the bloodstream. Imagine your cells waving at glucose but the door won't open. That's what insulin resistance or lack of insulin does. The result is persistent tiredness that doesn't improve with rest. Fatigue from high blood sugar often comes with brain fog, reduced motivation, difficulty concentrating. People tell me they feel like they're moving through molasses. It's different from the temporary tiredness after a long day. This one's chronic, subtle, and slowly erodes quality of life. That's why it's so often missed or blamed on busy schedules. Because fatigue is common and non-specific, it's important to look for other signs circling around it. Are you also thirsty, needing to urinate frequently, experiencing hunger despite eating? Those clusters create a clearer picture. Tracking your energy patterns, sleep quality, and meals can reveal if blood sugar swings are contributing. Practical steps. Focus on balanced meals with protein and fiber. break up long periods of sitting with gentle activity, and get a basic fasting blood glucose or A1C test if fatigue persists with other symptoms. Small changes can have big effects when underlying glucose control improves. Number 4. Blurred vision. When blood sugar climbs, fluid balance in your body shifts, and that includes the tiny lenses and tissues inside your eyes. Elevated glucose causes the lens to swell or change shape, temporarily altering focus and blurring vision until levels stabilize. Some people report short-term changes that come and go with their glucose levels. Others notice gradual worsening. Long-term uncontrolled blood sugar damages tiny blood vessels in the retina, diabetic retinopathy, which can lead to lasting vision loss. That's why early detection and blood sugar management are critical. Regular eye exams are essential if you have risk factors or symptoms. Number 3. Slow healing wounds. High blood sugar impairs circulation. High blood sugar impairs immune function. These wounds can linger and deepen because fewer immune cells reach the area and tissue repair slows. What used to heal in days may take weeks. Infections become more likely. I've seen minor foot sores become serious problems because they were ignored. Reduced sensation in the feet, nerve damage from high blood sugar. People may not notice wounds until advanced. That's a dangerous combination. Poor healing, plus reduced awareness. Pay attention. Feet. Pay attention. Hands. Pay attention. Areas with friction or pressure. Clean and inspect wounds early. Seek care if healing stalls. Look for redness. Look for warmth. Look for pus. Look for spreading. Early treatment prevents small problems becoming emergencies. Preventative. Good blood sugar control. Preventative. Daily foot checks. Preventative. Proper footwear. Preventative. Prompt medical attention for persistent sores. If you have repeated slow healing wounds, discuss this with your provider. It can indicate metabolic control needs adjustment. Number 2. Unexplained weight loss. Losing weight without trying can feel like a silver lining. But in the context of high blood sugar, it's a warning sign. When cells can't access glucose for energy, the body begins breaking down fat and muscle to meet energy needs. That causes weight loss even with normal appetite, or with increased appetite. This weight loss can be sudden and alarming. Muscle loss is particularly concerning. It weakens strength. It also reduces metabolic reserve and raises health risks. Always pair weight trends with other symptoms. Increased urination, thirst, fatigue, hunger. Immediate steps. Check blood glucose levels and consult your healthcare provider. Stabilizing blood sugar often stops unintentional weight loss. Chapter 7. Number 1. Constant hunger. This may surprise people. We usually associate high blood sugar with too much sugar, not hunger. If glucose can't enter cells, your body's tissues are literally starving. You eat. Glucose spikes in the blood, but cells still don't get the fuel, so the hunger signal persists. It's a frantic, insistent feeling, sometimes leading to overeating and weight swings. Persistent hunger despite regular meals is a key red flag, especially when paired with other signs on this list. It can become a vicious cycle. You eat to feel better. Glucose rises, cells stay deprived, and hunger returns. Over time, this pattern increases metabolic stress and deepens insulin resistance. Recognizing constant hunger as a metabolic symptom changes the approach. Rather than blaming willpower, look for physiological causes and address them medically and with targeted lifestyle changes. Structured meals with protein, fiber, healthy fats. These help stabilize insulin and keep hunger signals more reliable. If this resonates with you, start by tracking when hunger hits. Track what you eat and how you feel afterward. Consider a glucose check and professional guidance, because persistent hunger can be one of the earliest, most telling signs that your body needs help. If you notice several of these symptoms, don't ignore them. Your body is asking for help. When multiple signs appear together, the likelihood that high blood sugar is the underlying cause goes up significantly. This isn't about causing panic, it's about encouraging timely action so small problems don't become serious ones. Quick checks like a fasting glucose, random blood sugar, and A1C can give you important information. And remember, many of these symptoms respond well to early interventions, lifestyle changes, medical evaluation, in some cases, medication. The sooner you know, the more you can do to protect the organs and quality of life. If symptoms feel severe, sudden, confusion, difficulty breathing or other alarming changes, seek immediate medical attention. Otherwise, book an appointment with your healthcare provider, bring a list of symptoms, and ask about targeted testing. Reduce sugar intake. Stay active. Drink water. Eat balanced meals. These simple steps lower spikes, improve insulin sensitivity, help restore more stable blood sugar. They're not a cure-all, but they're powerful first moves. Anyone can make them while seeking medical guidance. We've walked through 7 quiet warnings your body may be giving you about high blood sugar. Recap. Here's a quick look back at those 7 signs. Take control of your health today. Subscribe to Vita Glow for more powerful health tips. Enable subtitles so you don't miss details.